Care Options for Kids does a great job at making sure we work as a team, not individual, and they make sure that we're happy and we're successful and we're prepared in everything we do, because that translates into how happy we are at our job and then translates into our families and the kids we see, and that's why we see such great progress.
We have incredible therapists that take their jobs really seriously and do a lot of continuing education to make sure that we're providing the most ethical and evidence-based care.
Especially in healthcare, things are constantly changing and evolving. They offer a lot of opportunities to take those classes, and it's free to clinicians. And I think it's just motivating, like when you work with new kids all the time, just to keep up on all the changes and make sure that you're providing the best care possible.
There's lots of opportunities for growth, and they always want people to kind of push themselves, either getting a specialty or becoming a clinical mentor, which Allie and I am. So we help lead monthly meeting groups, kind of providing clinicians in our area the newer processes in the company. And so they really encourage us to kind of be our best and, you know, have the best potential possible in the company, which I think is just so encouraging.
Because our populations are so different, like from kid to kid. There's so many kids that we have that are on the autism spectrum, and some kids that could possibly be on there, but we're not entirely sure quite yet. Continuing education is so important because you can use those skills. Getting that education is just going to help our sessions to better understand why they're having a hard time, or how can we help them to be the most successful that they can.
They'll have different speakers come that we are able to access. There's different teams that you can join as a therapist. So there's a AAC, which is Alternative and Augmentative Communication Team, which I'm a mentor on. So clinicians who are learning how to do speech generating evaluations can sign up to be a mentee through that program so they can learn what that process is like. There's feeding programs. So if you aren't as familiar with feeding and swallowing, you can be a mentee in that program. So we have a lot of supports in place to further your knowledge.
Just this last year, they, in addition to the certain areas that we have where we can pursue different types of clinical education, they've also opened up an opportunity where it's sort of a nondescript area, but if there's something that we really want to pursue just for our own interest or because we feel like it'll help out with the families we work with, they've allowed us to do that and have it count towards our annual CEUs that are required, which is really nice. And it again tells me that we're supported in our professional development.
Just that like feeling of being on a team. I feel like a lot of other companies don't offer that, especially in home health. You can be on your own a lot, and I think Care Options for Kids does a great job at making it feel more like a team environment.